Literally any issue you go with, the doctor asks for UPT. And why is it that? Now you may think, okay, we understand all this, but when a doctor asks us if we are sexually active and we say no, why don't the doctors trust us? And later on, it turns out she was not even 19-year-old, she was just 17. Hello guys, I'm Dr. Aishwarya Yajaman, NEET PG All India rank 778. I know the video title and my introduction are not quite matching. That's because I've only made videos regarding NEET PG till now. But I have this video idea in my head for a while now. But I was thinking if it reaches the right people, because basically my audience are NEET PG aspirants and not the general public. But I also don't know if I'll still be making videos once I join residency. And yes, I'm taking Ops and Gynae for PG. So I thought better try than regret. And it's your responsibility to make it reach the right people. Without any delay, let's get started. So a few days back, one of my friend's sister got heavy period cramps and she went to the doctor with the family. And the doctor asked for urine pregnancy test in the first place, and that freaked out the entire family. And when she told me this, I understood that this is because of gap of knowledge, and the doctor may not have time to explain this every time to every patient. I thought this video might be helpful for a lot of women out there, and there shouldn't be any fear for urine pregnancy test anymore. So that's why I thought of making this video. Everyone knows that when a woman in reproductive age misses her periods, it's very common for anybody to think of pregnancy, and that's why the doctor asks for UPT. But why is it that any issue with the periods that you go with, that is either you are having early periods or late periods, irregular periods, heavy bleeding, more pain, literally any issue you go with, the doctor asks for UPT. And why is it that? Let's understand through this video. So let's discuss each scenario one by one. First thing is when a woman goes with heavy bleeding. In that case, the doctor might be suspecting an abortion. Like abortion, as everyone knows, it is early termination of pregnancy before the fetus reaches the viability, which is 28 weeks in case of India. And when it happens without the intervention of a doctor, it is called as abortion. It presents similar to heavy periods, like there will be heavy bleeding and pain as well. And an urine pregnancy test can easily differentiate between an abortion and just a heavy periods. Also, one more scenario is heavy pain. When a patient presents with less bleeding and more pain, the pain can indicate a burst ectopic. Ectopic pregnancy is simply a pregnancy that happens anywhere other than uterus, which is normal place for pregnancy. It could be anywhere in the abdomen or elsewhere too. And when it gets bursted there because it is not viable in that place, it is a potentially fatal condition for the patient. So a simple pregnancy test can help in the diagnosis and save lives. Even if the patient goes with light periods and or spotting, as we can call it, the doctor still suggests UPT because in the early pregnancy, due to placentation, the process in which the placenta gets attached to the uterus, that can lead to spotting or light bleeding, and the patient may not understand that it is due to pregnancy and just think as light periods, but it could be a sign of pregnancy again, and UPT helps with that too. Now you may think, okay, we understand all this, but when a doctor asks us if we are sexually active and we say no, why don't the doctors trust us? When we trust them with our lives, why don't the doctor trust their patients? It's not that the doctor doesn't want to trust you, but the protocol says the otherwise. Many doctors come across such situations on a daily basis, and not every patient tells the truth. I'll tell you an example from my own experience. So this happened during my internship. I was in the surgery department, and me along with my senior doctor were in a casualty seeing some other case. A case referred from a nearby Taluka hospital came there. The girl was 19-year-old and the complaint was inability to pass the urine, and she had gone to the hospital the previous day, and there they have catheterized the patient, which means that they have put the urine tube and they have sent her back home. And the next day she has gone back to the hospital again. There was not much urine output, and hence they had referred her to the district hospital. And when we saw the patient, she was in pain but not much. She was conscious. She was able to give the history, and on examination there was slight suprapubic bulge, which means that there is slight bulge in the lower abdominal area. And again the complaint was same, that she was not able to pass the urine, and there was no collection in the urine bag as well. So when I showed the case to my senior, he suggested that let's change the urine pipe, which gets blocked very often, and it is a very common scenario that urine pipe gets blocked and there is no urine in the bag. But what is unusual is, at that age and without any history of any other things, just urine block is very unusual. But that's the only history we got. And meanwhile, we were also asking her last menstrual period, because it is a norm to ask LMP for every woman in reproductive age, whatever complaint she may arrive with. As per her history, her LMP was 1 to 1.5 months ago, and she had no other problem. And when I tried to change the urine pipe, I noticed a bulge from her vagina, which was suspicious. So I immediately called my senior, and then we referred the case to the obs and gynae department. And within half an hour, she delivered a baby at 32 weeks. And we were all very shocked. And later on, it turns out she was not even 19-year-old, she was just 17. And then a POCSO case was filed. Thankfully, both mother and the baby survived. Otherwise, the case would have been even worse. With such little experience that I have, if I have already come across such a case, imagine how many cases like that happen across India. You may not be lying, but not every patient is same. She might be lying for whatsoever reason. But as a doctor, to save the patient from potentially fatal conditions, urine pregnancy test is a simple and very cost-effective test which has proved to be so helpful. So next time when you visit a gynae and he or she asks for a urine pregnancy test, please don't freak out. Don't think that the doctor doesn't trust you. It's not about trust. It's about saving you and saving themselves. So if you find this video helpful, please share it with your mother, your sister, your friends, your girlfriend, your wife, basically every woman you know. And make sure to subscribe to my channel. And thanks for watching.